Ontario, like many other provinces and jurisdictions around the world, is in the midst of the third wave of the COVID-19 pandemic. Driven by variants that are more transmissible and more likely to lead to hospitalization, this wave has proven to be much more difficult to deal with. Our government continues to use every tool at our disposal to address the challenges facing our hospitals. This includes redeploying staff to where they are needed most, transferring patients to alternate hospital sites in surge situations to maximize system capacity, and ensuring that our hospitals have the resources required to provide care for patients. These have not been easy decisions, but they are necessary ones. Today, we are taking further action by temporarily amending an emergency order to ensure hospital beds are available for COVID-19 patients in need of urgent care, while ensuring every patient is able to receive quality care in the most appropriate setting. This temporary emergency order will provide hospitals with the flexibility to transfer certain patients, those whose doctors have determined no longer require hospital care and could be better supported in a more appropriate setting, to a long-term care or retirement home. This would be done in only the most urgent of situations, when a hospital is at risk of becoming overwhelmed. We will ensure patients or their substitute decision makers will have the opportunity to be actively involved in and consent to their transfer. Hospitals may rely upon this order only when absolutely necessary to respond to a major surge event and when the attending physician is satisfied that the patient will receive the care they require in their new setting. I want to emphasize that these patients are often waiting to receive care in another setting. The most appropriate care for them is not always in a hospital bed. These transfers would only be made when medical professionals are confident they will not compromise the patient's medical condition and after a full consideration of any ethnocultural or language concerns. It's very important to note that this would be a temporary transfer and that any patient who is transferred to a long-term care home that is not their first choice will continue to maintain their place in line for their first choice. In addition, our government has waived the copayment for patients who are being transferred to a long-term care home or a retirement home until they can be placed in their first choice setting. Every effort will be made to ensure patients have been fully vaccinated before being transferred. And every effort possible will be made for any transfer to be as close as possible to the patient's family. This was a very difficult decision to make. However, the consequences of not doing so could be devastating if we don't have the hospital beds we urgently need to care for the growing number of COVID-19 patients across the province. Our government's top priority has always been ensuring the health and well-being of everyone in Ontario. We will continue to ensure patients are receiving the appropriate care in the safest setting.